An hysterical surgeon scribbles theories all over the office, and an older doctor walks in and yells at him to stop. He scatters things around in frustration and bursts into tears. What's wrong? And why is the older surgeon in tears? This video will answer that question and any other questions you have. But first, I'd like you to subscribe to this channel and like this video. Welcome back to Lion Recaps. Today, I'll explain episodes 17 and 18 of the series The Good Doctor, released in 2017. Shaun finds a glass of milk and a letter from Kenny outside his apartment. In the letter, Kenny thanks him for always being there for him. Back at the hospital, Shaun, Dr. Andrews, and Dr. Park meet with Gretchen, who has Mobius syndrome. She and her father, Mr. Millman, hope an elective surgery will give her the ability to produce facial expressions, especially a smile. No one can tell when Gretchen is happy or sad, as she cannot express any emotions. Gretchen makes a joke, and Shaun asks if she wants to be a comedian and adds that people getting her jokes must be important to her if she's ready to risk dying during elective surgery. Shaun questions the importance of the procedure. Mr. Millman is unhappy with Shaun's comments, and Dr. Andrews apologizes on his behalf. Dr. Andrews assures Mr. Millman that his daughter is in proper care. In the meantime, Dr. Melendez, Morgan, and Claire treat a patient named Lucy who has a post-op infection. Lucy hasn't been using her prescriptions, and now her condition is worse. Shaun avoids Dr. Glassman in the lobby while buying an apple, but Dr. Glassman reaches out and tells him they can still talk since they're colleagues. Shaun asks if he has a new friend and tells him about Kenny. Shaun notices Debbie, the cashier, is flirting with Dr. Glassman as she has handed him an extra $1 in change. She smiles at Dr. Glassman. Shaun and Gretchen talk, and Shaun tells her he doesn't want people reading his emotions. Gretchen tells him that's what most people do with friends, and he looks away. Gretchen asks if the surgery is risky, so Shaun lists the possible risks and adds that the procedure is expensive and medically unnecessary. Morgan thinks Lucy is a parasite, but Claire believes she's not. When they return to the ER, they find it empty as Lucy is not there. Gretchen doubts the surgery and tells her dad she no longer wants to do the surgery. Dr. Andrews confronts Shaun, whom Gretchen claims have talked her out of the surgery. Dr. Andrews thinks Shaun doesn't want Gretchen to ever smile and explains to him that smiles are healthy and contagious. He orders Shaun to talk her back into it and bring Dr. Park along. Dr. Kalu and Celeste are reunited. Some episodes ago, she suffered a serious burn, and Dr. Kalu applied tilapia scales as part of an experimental procedure that would allow her real skin to grow back over time. Celeste is back for a consult and asks Dr. Kalu when she can remove the tilapia skin. He says she can have it taken off the next day, and she becomes nervous about how she'll look. He assures her that she was going to look beautiful, and there's an obvious attraction between the patient and her physician. After some coaxing from Dr. Andrews, Gretchen reveals Shaun didn't talk her out of the surgery, but had inspired her. Dr. Park suspects that she's lying. She changed her mind because the procedure was very expensive and not covered by insurance. Claire learns that Lucy has returned, but when they meet her, they discover the woman they treated was not really Lucy, but an imposter. The real Lucy complains of shingles and asks for pain medicine. Claire tells Morgan that they cannot give her any medicine because they're already creating a Lucy, albeit an imposter. Dr. Andrews visits the insurance office in person and persuades them to cover Gretchen's surgery. He convinces the owner that facial expressions are a function. Shaun visits Dr. Glassman in his office and tries to test Dr. Andrews' theory that smiles are contagious, but Dr. Glassman doesn't think they are. Shaun tells him he wants to show him something and leads Dr. Glassman to the cafe. He matchmakes Debbie and Dr. Glassman as Shaun feels he needs a friend. Gretchen agrees to go forward with the surgery. Meanwhile, the imposter returns and goes into septic shock. They report her condition to Dr. Glassman, who tells them to maintain the pretense, but the hospital will press charges when the imposter recovers. Celeste returns to the hospital to have Dr. Kalu check her tilapia skin grafts. He removes them and tells her she's beautiful. Through research, Morgan and Claire discover Lucy is addicted to pain pills, and her case of shingles was a cover. Shaun checks on Gretchen, who does not appear to wake up from anesthesia. The doctors conclude she's brain dead. Dr. Glassman and Debbie have an awkward first date, but they discover a shared interest in cars. Dr. Kalu realizes he has feelings for Celeste and confesses to Shaun. Dr. Park develops a hypothesis that Gretchen may have an extremely rare deficiency leading to a long wake-up time. Dr. Andrews tells him not to tell Mr. Millman. The imposter's condition worsens rapidly, and all her organs are failing. She eventually reveals her true identity to Claire. Claire learns her name is Beatrice. Morgan confronts Lucy about her addiction and talks her into going to rehab. Meanwhile, Dr. Park's hypothesis is correct, and when Gretchen awakes, she smiles. Everyone is thrilled by the result of her surgery. Dr. Kalu takes Shaun's advice. Since doctors are not allowed to date their patients, Shaun agrees to take over Celeste's case so she and Dr. Kalu can begin seeing each other. Beatrice flatlines, but Morgan and Claire ultimately elect not to try and revive her as there is nothing left to save. As Dr. Kalu prepares for his date with Celeste, he receives an acceptance letter from a medical school in Denver, Colorado. That night, Shaun arrives at Kenny's apartment for pizza night, but Kenny's friends show up unexpectedly. Kenny borrowed Shaun's TV but refuses to let Shaun in, citing Shaun's quirks are uncomfortable. Kenny takes the pizza for himself, and Shaun is hurt. Dr. Glassman and Debbie go to a restaurant together for their second date, and when Dr. Glassman tries to ask for the check, he repeatedly asks for a doorstop instead. A panicked Debbie asks the waiter to call an ambulance. Shaun tells Dr. Glassman that he wants to be his friend again and insists that he needs a friend more than he needs space. Shaun tells him he's a great mentor and a good friend, but learns Dr. Glassman is dying. He has 12 to 18 months, and he doesn't want Shaun to tell anyone. Dr. Glassman learns that he has a tumor, and Shaun tells him he needs a second opinion. Dr. Glassman proves stubborn, but he urges him to see someone else. Dr. Kalu and Dr. Lim examine Caden, a patient with a dislocated ankle. He's drunk and in pain. He heads into surgery with Dr. Melendez, who keeps him awake because of a possible concussion. His heart rate suddenly falls. Shaun works on his dry erase board, but he is upset as he suddenly searches for something. Dr. Glassman comes in and tells him he's explored it all. Shaun tells him he needs to go back to work. Dr. Kalu comes out of surgery to ask Blake, Camden's friend, what really happened. Blake confesses that he ate detergent pods during an initiation ceremony. Back in surgery, Shaun and the rest of the team finish up. Dr. Melendez makes him lead. He has an epiphany and announces that he lost something, but he knows where it is now. He leaves surgery and heads to see Dr. Glassman. Shaun has lost his scalpel that his brother Steve gave him as a gift when he was young. While he looks, he tells Dr. Glassman that he needs to get more imaging and a DTI scan. Shaun talks to Jessica about Dr. Glassman's condition and asks her to talk to him as he won't listen to Shaun. Morgan believes that Shaun may have made a mistake during Caden's operation as he was distracted. Dr. Melendez says it was not a physician error, and Claire defends Shaun. Dr. Melendez reports to Dr. Glassman about Shaun's patient. Dr. Melendez doubts the possibility of Shaun's error, as he's never had issues in the OR. He, however, wants to know what's going on with him. So Dr. Glassman tells him he has a brain tumor, and that must have been what distracted Shaun. Dr. Park and Dr. Kalu go over to the drunken teen's file. They think he may be on drugs, so they ask Blake, who confesses that they're both on Molly. Jessica confronts Dr. Glassman and talks him into getting a second opinion. Dr. Andrews asks Dr. Melendez about Caden and why he left 3 first years unattended. He says they do this all the time, and Dr. Andrews hopes that Caden pulls through. Shaun goes with Jessica and Dr. Glassman to see a different doctor. The first doctor was wrong, and he has the most aggressive form of brain cancer. She adds that he only has 3 to 4 months to live. Shaun and Dr. Glassman zone out in sadness. The team now thinks Caden has a bacterial infection. Meanwhile, Shaun cannot stop trying to come up with a solution. He's become hysterical as he writes theories all over the office. Dr. Glassman yells at him to stop. He tells Shaun that he doesn't want to think about the tumor and starts crying and throwing things. Dr. Glassman wants to have fun and asks Shaun to come with him. When his heart rate plummets, Dr. Melendez and the team rush Caden into surgery. Meanwhile, Shaun and Dr. Glassman are at a carousel. He tells Shaun about his daughter. Shaun confesses that he's lost his toy scalpel. Shaun gets a page and gets off the carousel. Dr. Melendez and the team rule out the bacterial infection since he isn't reacting to antibiotics. Shaun confesses that he accidentally squeezed the artery during surgery and then runs to Dr. Glassman's office. He thinks he has a solution. but Dr. Glassman has accepted his fate. Shaun mentions a biopsy can be done through his nose. Shaun says he cannot die too. The team debate on whether to support Shaun or not. Dr. Kalu suggests reporting the incident, but he will take responsibility instead of Shaun. Dr. Melendez refuses and says the team will face the consequences together. Shaun comes up with an idea to save Caden, and Morgan believes Shaun's idea will work because he makes saves no one would have thought of. Dr. Andrews looks into Dr. Glassman's promise that Shaun will remain excellent at his job. If he fails to, he will resign as president of the hospital. Shaun will be relieved of his residency at the hospital. In surgery, Shaun feels Dr. Melendez or the team should not be responsible for the outcome of his idea if it fails, but Dr. Melendez believes they should work together. He wants to take the team out after. Dr. Melendez tells Morgan that she will have someone killed at some point in her career, and he hopes anyone will still believe in her. Shaun goes to see Dr. Glassman and notices a Band-Aid. Shaun learns that he had the biopsy and could survive. He only needs surgery and chemo. Shaun is thrilled and hugs Dr. Glassman. They then head to Dr. Andrews' office to confess that Shaun made a mistake in surgery. Jessica says Shaun has been an excellent surgeon and believes Dr. Andrews would use his mistake to have Shaun and Dr. Glassman fired. Shaun tells Dr. Glassman he loves him more and that they're friends. That was all from the video. I hope you liked it. Subscribe for more content like this and hit the like button to help us out. Also, leave a comment if you want us to recap your favorite movie. Until next time, take care.